Didn't have any wheels, so I used dice. Hey guys, I'm not abducted. Just another day in the office. I'm here with my good friend Ulises Ley I. He was nice enough to write me 4 medical questions, which
I didn't write them. I googled them, and I googled, can you answer these 4 USMLE Step 1 practice questions?
Sounds more like you, Izzy. So I'm gonna link the link in the description below. Try out the questions first. Shout out to the website. Come back and then make fun of me while getting the questions wrong. Why you gotta water balloon your hand already? If I get a question wrong, he's gonna slam me in the face with a water balloon, hopefully softly. If I get it right, then we're gonna move on to the next one, and I just give you some information as I'm doing the questions. So let's get started. Quick clarification before we start. The questions he's gonna ask me were shortened for time purposes. I'm gonna put the full question here. You guys can pause it, read through it, or just listen to what he's saying. So go easy, start.
A 67-year-old male with colorectal cancer presents with fever and shortness of breath. His hands are more red than usual, and there are painful lesions on his fingers. He presents with a holosystolic blowing murmur, best heard in the mitral area. Blood culture is positive for a gram-positive coccus. Which organism is most likely responsible for the patient's disease?
That's all you got for me? That's all you got? Let's discuss real quickly just a little bit of anatomy. So the heart pretty much is 4 rooms, right? You have the upstairs with the atriums and the downstairs with the ventricles. The rooms are separated by doors, and these doors represent valves. Now, when a valve is injured and it makes a particular sound when closing and opening, that's referred to a murmur. You guys maybe have heard of it before. Now, murmurs are described with different sounds. This one's described the way that they holocystic, you said?
Holosystolic, yeah.
Holosystolic murmur, and it just describes a particular sound. So we're thinking of an older patient. He has a history or has currently colorectal cancer, so he has cancer. He has a murmur, and he has his little lesions in his fingers, which are very characteristic to Janeway lesions, which makes me think of a possible endocarditis. So that's kind of where my mind is currently at right now. Read me the options.
You have Staphylococcus aureus.
All right, aureus is usually with IV drug usage. It can possibly give you endocarditis. Go.
Streptococcus bovis.
Okay, next.
Staphylococcus epididymis.
Okay, that's with our prosthetic implantations.
Streptococcus virulence.
Okay, post-injury to valves. Next.
Echinella corridens.
I'm not sure. So, can cause endocarditis, but they all have a particular add-on to them. And I think, pretty confident, the answer is both.
Final answer?
That is my final answer.
What? You're right. Ding, ding, ding. Winner, winner, chicken dinner.
A little hot in here.
Next question I have for you is, what are the Hasek organisms?
Hasek organisms, huh? They can also cause endocarditis, but they're very rare causes. You want to know what they stand for, what it does?
What are they?
Their names, so they each have a name, and you have Haemophilus. Yeah.
That's one.
You have cardiobacteria. You have how do you spell Hasek again? It's
how do you spell Hasek?
Woo! It was getting a little hot, so that feels pretty good. Wow, what a shoulder hit! That was like shoulder ear.
A 17-year-old female patient who took the remains of a bottle of extra-strength acetaminophen 13 hours prior to arrival. Okay. She currently is diaphoretic and nauseated. Her serum acetaminophen plasma concentration is 38 micrograms per milliliter. Which of the following statements are correct?
Overdose of acetaminophen, and let's go on for the, go on.
Alright, so the answer choices are acetaminophen that is not excreted in the urine is metabolized to N-acetyl-P benzoquino.
Sound it out.
Benzoquinonemine, also known as NAPQ, which is what we know it as.
NAPQ, got it.
The next one is N-acetylcysteine should not be administered because her plasma acetaminophen level is below the line of Ramuc-Matthew line. Oh, I did. Yep. A better estimate of the amount of acetaminophen ingested by this patient could have been obtained an hour post-ingestion. Okay. liver function abnormalities will peak in the next 12 to 24 hours. Okay. And the last option is gastric decontamination with activated charcoal will reduce further absorption of acetaminophen and has been shown to improve outcomes.
So this is a little doozy here. A lot of them that I'm not particularly too sure about. I do know that the last one, for example, I wouldn't go for it because I think you said already 13 hours of, or it was 13 hours, I think.
13 hours, yeah.
That she already had, so it's probably already absorbed at this point, so that wouldn't help. I'm not really sure about the other ones, like liver peak damage, but I would probably go for what I believe to be correct, which was A, and that it can be turned into NAPQ, and that's my answer.
Are you sure?
No, definitely not.
Correctamundo.
What I do know about this is that acetaminophen can go into the body and it can be conjugated to these non-toxic materials that you just excrete through the urine, or it can also turn into NAPQ, which is a toxic material. But our bodies are lucky enough to have this thing called glutathione, and glutathione pretty much picks up all the radicals and takes away radical damage and cleans up and detoxifies the body, and it helps with NAPQ. But when you ingest too much of it, you oversaturate glutathione, therefore you end up having possible liver damage. So that's what I know.
A 37-year-old female with end-stage renal disease comes into the emergency department following a syncopal episode. Her creatinine is 11 milligrams per deciliter, BUN is 80 milligrams per deciliter, and her potassium is 9.0 milliequivalents per liter. An ECG is seen here. What is the most appropriate initial step in management? On the ECG, you see peaked T waves. So it says it or just shows it to you? Yeah, it just shows it to you. Alright, so pretty much I'll have the picture here. And let me see it. And essentially, I'm going to take a quick look.
Get it? Alright, so yeah, it's pretty obvious. You have, so in an EKG, to make it very simple, it is a representation, a visual representation of the electrical impulses that happen in the heart. And they all implicate a particular action happening. So the way they work could be a little complicated, and they could pretty much allude to a lot of different pathologies, but you have your first wave, which is a P, then you have a complex of a QRS, and finally you have a T, and then maybe you have a U. But the T right now in this particular question is very, very elevated, much more than what it usually should be. So off the bat, we think of a hyperkalemia, an increase of potassium in the body that could potentially cause arrhythmias or even a heart attack.
Answer choices are intravenous dextrose, intravenous calcium gluconate. Okay, so dextrose, I believe, will decrease potassium. Next. Emergent hemodialysis, which will also decrease your potassium. Intravenous furosemide, diuretic that will decrease your potassium. Intravenous sodium bicarbonate.
We'll go for hemodialysis, emergent hemodialysis, because the patient with very high BUN, creatine, potassium levels, and there's end renal stage failure, so that would probably be my guess.
You sound more confident than the last one, are you sure?
Bueno, seeing you all standing up, not making me too sure anymore.
Well, I hate to tell you, but in this occasion, you are wrong, my friend!
Can you like kind of wet my hair a little bit? I'm feeling a little hot here. There's a lot of mental stuff. Okay,
I got you.
Next question.
A 22-year-old male with recurrent episodes of dizziness. He has become increasingly dizzy during his daily walk. You notice a new systolic murmur heard best over the right upper sternal border, over the second intercostal space. What is most likely the cause of this patient's symptoms?
Well, how old was he?
He is an 82-year-old male.
Okay, so off the bat, to clarify something, once again, this is talking about valves, another cardio question. The valves that we speak about, usually referring to, is an aortic valve, a pulmonary, tricuspid, and a mitral. This patient we're referring to a second intercostal space being the aortic valve. All right, so what you got?
Here we have stretching of the mitral valve.
Next, because we're thinking about aortic, so off the bat, anything with mitral, we're not going to consider.
Weakening of the mitral
Next.
valve. Can you even give me a chance?
Next.
Congenital malformation of the aortic valve.
Okay, next.
Calcification of the aortic valve.
Okay.
Formation of vegetations on the mitral valve.
No, so off the bat, we don't think of mitral. So here we're thinking of a congenital malformation or calcification. So congenital malformation will be something that you see at a very early start of his life. Therefore, I will eliminate that one and I'll go for which is probably one of the main causes of a I'm standing up. This is one of the main causes. So one of the main causes of a systolic murmur in an elderly patient, because you get this increase of calcium in the aortic valve, and then it can't really open. It causes a stenosis, and then you have decreased blood going into their body, and they could get dizzy, they could faint, and so on and so forth. That is my answer.
What is your answer?
The right one. Build up of calcium in the aortic valve.
You are correct, my friend. What year did Lincoln become president?
Well, this is part of the 4 questions.
Of course.
I thought it was supposed to be medical oriented.
Listen, bro, this is as medical as it gets. What year did Lincoln become president?
Oh man. Oh god. Well, you know, 1860. I think that's something.
1860.
That's something. Woo! Man, I could have sworn I seen that.
No, he was elected in 1860. He became president in 1862.
That was close. That was close.
All right. Last question I got for you. How did Lincoln die?
What?
How did Lincoln die?
Alright. Hold on.
How did Lincoln die?
He got
Dr. Ley, how did Lincoln die?
He got shot.
He got shot in the head.
Alright, so I completely forgot to do an intro and outro. That was Are You Smarter Than a Medical Doctor? Make sure to comment, subscribe, and I'll see you guys next Sunday. Wow! What a shot! Oh man! If that would have hit my face, that would have been case closed.